Good afternoon. Apologies for the late start. You know, I'm very military, so I apologize for that. Thank you all for your patience. Today is Friday, March 3rd, 2023, and we have 12 bills that we will consider today. We will take them in the following order unless something changes. We'll start with Senate Bill 726, 727, 728, 730, 731, 827, 644, 494, 574, 423, 560, and conclude with Senate Bill 668. To our guest, the sponsors have 2 minutes, and the sponsors have as much time as they need to present the bill. We will set the clock at 2 minutes for testimony today. So if you're presenting, please be mindful of the clock that will alarm at the 2-minute mark. We do have members that will be in and out during today's hearings as they are presenting bills in other committees. No disrespect to you or your testimony. If you see members going in and out, they likely have responsibilities in another committee room for their bill hearings. So with that, we will start our hearings for the day with Senate Bill 726, State Board of Psychologists Sunset Extension. And I have Lorraine Smith and Megan Peters speaking on the bill. Good afternoon. You can start when you're ready.
Good afternoon, Chair Griffith, Vice Chair Klossmeyer, and committee members. My name is Megan Peters, and I am the Acting Director of Governmental Affairs for the Maryland Department of Health. I am here today to testify in support with amendments for Senate Bill 726. This is a departmental bill that extends the Psychology Board's statutory and regulatory authority. As introduced, the extension is for 3 years, and upon further review, the Department of Health recommends a 2-year extension. We're currently focused on ensuring that the boards are running smoothly so our healthcare professionals are able to enter and remain in the workforce. And we believe the more thorough evaluation of our state boards is needed to assess ongoing concerns regarding licensure, technology, and administrative functions. And we believe a 2-year sunset extension allows ample time to examine these functions and return to the General Assembly with an update. So with that, MDH requests a favorable report with amendments to this bill. Thank you.
Good afternoon. My name is Lorraine Smith, and I'm the Executive Director of the Board of Psychologists. And I thank you for this opportunity to testify in support with an amendment on this bill. As you know, today more than ever, it is essential that Maryland have a variety of qualified psychologists with different skill sets to accommodate the mental health needs of the public. The board licenses child psychologists, clinical psychologists, neuropsychologists, counseling psychologists, and forensic psychologists, just to name a few. These disciplines serve people of all ages and nationalities in Maryland. Interrupting the board's work could slow down the board's mission of protecting the public. The board works to prevent possible exploitation and harm to Marylanders by licensing those that meet certain qualifications, establishing a method for consumers to file complaints, and a process to discipline providers who violate the standards of competency. Over the years, the board has consistently improved its work processes by implementing online licensing system, an online payment system, an online exam, requiring background checks, and expanding mental health providers by registering psychology associates. The passing of this bill with the amendment will ensure the continuation of the board's mandate to protect the citizens of Maryland. The board respectfully asks that the committee amend this legislation to extend the statutory and regulatory authority of the board for 10 years until July 1 of 20 33, as customary, as in the past. As you all know, can I finish that sentence? As you all know, back in 2019, a bill actually passed, Senate Bill 640, that allows the board to undergo an evaluation at any time. So there's really no need to not give us 10 years, because at any time the board can be evaluated. You no longer have to wait until 10 years to evaluate the board. Thank you.
Thank you both. Senator Lamb.
Thank you, Madam Chair, and thank you to the panel. You touched on what I was going to ask, which is in the past, traditionally, it's been 10 years. It seems like the department and the board are not obviously on the same page when it comes to the duration of this sunset extension. And in looking at some of these other bills, it looks like the department has asked for 2 years, I think, on all of them across the board, right? You touch on the fact that I think the department wants to take a clean look at all of these boards. I think some boards seem to have some more challenges than other boards, but you're applying this rule across the board for, I guess, no pun intended, across the board for all the boards. But can you tease that out a little bit more as to the rationale that this is an across the board request of the department for a 2-year sunset for all of the boards? It also generates more work for DLS, because DLS staff do a lot of the review in the background for these sunset extensions. And I think previously it was housed more within DLS, but now it's been moved to the Office of Program Evaluation. And so, if you could explain that a little bit more, that would be helpful.
Yes, thank you for the question, Senator. To answer your second part with the DLS providing the evaluation, we would be looking, to partner with them, but also be led more through MDH and the boards kind of working through an evaluation in the 2-year period. And for the 2-year, again, we just want to ensure the boards are running smoothly. Like you said, we do recognize that there's different operations and performances for these various boards, but just the department and the administration want to just take a thorough look and believe that 2-year span allows us to do a thorough look, evaluate, and come back with an update and recommendations that can be enacted.
Is this potentially in preparation for legislation next year that would take a look at how to bring all the boards under more of the umbrella of the department? Is that why you're looking at a 2-year duration? We're
looking at it to be able to, look at how they're all operating and running, and then look at our recommendations and come up with a plan from there.
Okay, because there was legislation last year under the prior administration that did not pass that looked to try to bring the boards more under the umbrella of the department. And I'm just curious if that was the intent, that the department may be looking forward to that as to why only giving a 2-year extension of this. It just seems like there's a big gap between, what's traditional and customary, which is what the board's asking for, and what the department's asking for now. Okay. All right. Thank you, Madam Chair.
Thank you, Senator. Senator Hayes.
Madam Chair, I'm not sure who's the appropriate person to answer this, but it came to my attention last year that with sunsets, the Department of Legislative Services used to do these periodic reviews whenever they came up. But the department has decided not to do the reviews unless there's an express interest of the legislature. I don't know if anyone is available to validate that or not. David just shook his head, yes, that's the case. So the department don't actually provide the reviews that they used to. Only if there's a request from the legislature, they provide these reviews. And so I get kind of what the department is trying to do here. With a new administration, it seems to make sense that you are asking for a little bit of time to see what's going on with new secretary and all those other pieces with the various boards before you extend the extension. Is that what we're trying to achieve here?
Correct.
Thank you so very much, Madam Chair.
Thank you, Senator. I see no further questions for these witnesses. Thank you very much for your testimony. And we do have one virtual witness signed up on the bill. Samantha Ruckert, good afternoon.
Good afternoon. Can you hear me?
We can.
Great. Good afternoon, Madam Chairperson and members of the committee. My name is Samantha Ruckert. I am a psychologist on the Board of Examiners of Psychologists, currently serving as the chair of the board. I'm testifying today in support of Senate Bill 726 with one amendment. You should have received the board's position paper. As you all know, the Board of Psychologists is a group of 7 licensed psychologists and 2 consumer members appointed by the governor to administer and regulate the laws regarding the practice of psychology in Maryland. Our specific functions include, as Ms. Smith mentioned, licensing psychologists, approving psychology associates, renewing licenses, reviewing continuing education requirements, promulgating regulations, interpreting the scope of practice, educating licensees, and investigating complaints. The board's mission is to serve and protect the public and ensure that consumers in Maryland receive quality psychological services in accordance with state laws. Belief in and a commitment to this mission was my primary motivation for joining the board in 2020. And over the last 3 years, unprecedented challenges like the COVID pandemic and the cyber attack on MDH have changed, but have not diminished the work of the board. The board respectfully asks that the committee amend this legislation to extend the termination provisions from 2026 to 2033, extending the statutory and regulatory authority of the state board until 2033 will ensure that the board's vital functions continue without disruption. The board appreciates the committee's consideration and respectfully asks that you vote in favor of this bill, including the aforementioned amendment. Thank you for your time.
Thank you for your time and your testimony. I see no questions from the committee for you, so have a good afternoon. And that will conclude the hearing on Senate Bill 726. We'll now turn to Senate Bill 727, which is the State Board of Physical Therapy Examiners Sunset Extension. It looks like we have Lori Kendall Ellis and Megan Peters. Good afternoon.
Good afternoon. For the record, again, my name is Megan Peters, Acting Director of Governmental Affairs for the Maryland Department of Health, here to testify in support of Senate Bill 727 with amendments. Similar to what we previously just discussed on the other bill, this is a sunset bill, departmental bill that extends the Physical Therapy Board's statutory and regulatory authority. It was introduced with an extension of 3 years, and MDH recommends a 2-year extension. We're focused on running the board ensuring the boards are running smoothly for our healthcare professionals, and we believe a thorough evaluation of the state health occupations boards is needed at this time to assess the ongoing concerns related to licensure, technology, and administrative functions. Therefore, we believe a 2-year extension allows us ample time to go back and review and come back with recommendations that can be enacted. In closing, we request a favorable report with amendments for this bill. Thank you.
Thank you, Chair Griffith and members of the Finance Committee. Happy to be in front of all of you again. My name is Lori Kendall Ellis. I am the Executive Director of the State Board of Physical Therapy Examiners. On behalf of the Board of Directors, we appreciate the opportunity to express our support for Senate Bill 727 with amendment to extend for 10 years so that the Board of Examiners will have their sunset extension July 1st of 2034. Of significance in the board's position papers rationale, which the committee received, the OLA auditors did not recommend sunsetting the Board of Physical Therapy Examiners sooner than historically valued, and also did not name the Board of Physical Therapy Examiners in their findings. On January 5th of 2023, the MDH Office of Internal Controls, Audit Compliance, and Information Security, IACS for short, sent a status report to OLA for the period ending April 30th of 2022, determining that the Board of Physical Therapy Examiners has satisfactorily completed the Health Professions Boards and Commission audit findings found in the January 19th, 2021 OLA report. Our board's work ethic of continuous operational improvement and effectiveness enables us to rapidly respond to the unusual events such as COVID-19 and the December 4th, 2021 cyber attack incident. We are proud to say we do not have a licensing application or license renewal backlog. The board is issuing licenses within 1 to 5 days upon receipt of all the required documents by the applicants. Utilizing the MDH intranet Quorum IQ system data in fiscal year 2022, there were a total of 19 inquiries received and closed. And that has been verified by the Office of Constituent Services, and there were 0 complaints. The Board of Physical Therapy Examiners is a proven fiscally responsible customer service centric organization. Our mission is to protect the public, and we ask that we continue to be able to do so by passing the Senate Bill 727 with the amended extension to July 1st of 2034. Thank you.
Thank you very much. I see no questions. Thank you very much for your testimony. That concludes the hearing on Senate Bill 727. We'll now turn to Senate Bill 728, State Board of Examiners in Optometry Sunset Extension. And we have Gwendolyn Joyner and Megan Peters. Good afternoon.
And good afternoon.
Hi, again, my name is Megan Peters, for the record, Acting Director of Governmental Affairs for the Maryland Department of Health. Here today to testify in support of SB 728 with amendments. This is another sunset bill and departmental bill that extends the authority of the Optometry Board. It was introduced with 3-year extension, and MDH recommends and is suggesting a 2-year extension. As again, we want to focus on ensuring that the boards are running smoothly, and believe that a 2-year extension gives us ample time to evaluate, make recommendations, and come back and enact those and provide an update to you, the General Assembly. As such, MDH requests a favorable report with amendments for SB 728. Thank you.
Good afternoon, Honorable Chair Griffith and committee members. My name is Gwendolyn Joyner. I am the Executive Director for the Maryland Board of Examiners in Optometry. I want to thank you for this opportunity to testify on behalf of the board in support of SB 728. Written testimony has been submitted. The board is mandated to regulate the practice of optometry in Maryland and protect the public and welfare of its citizens by ensuring the delivery of vision services by qualified optometrists. It is the responsibility of this board to credential and license applicants, certify optometrists to use diagnostic pharmaceutical agents and therapeutic pharmaceutical agents in the practice of optometry. Monitor continuing education programs and continuing education compliance, investigate complaints against licensees concerning alleged violations of the law. During the COVID-19 pandemic, the cybersecurity incident, the board continued to issue licenses to initial applicants to include renewal and reinstatement of licenses to optometrists in Maryland, as well as optometrists from other states. The board currently has over 1,000 licensed optometrists in the state of Maryland. The recent proposed telehealth regulations will allow optometrists to provide eye care remotely to individuals who live in rural areas of the country where eye care may not be easily accessible. It is a considerable burden administratively and legislatively to come back in 2 or 3 years due to a limited staff of 2 people with preparation to reestablish a state board that is over 100 years old and without blemish, especially since historically, prior to last year, boards including optometry had always been approved for a 10-year reestablishment period. Maryland Board of Examiners in Optometry would like to thank the Maryland Optometric Association for their letter of support for SB 728 with amendment, and respectfully and request that the committee amend this legislation to extend the termination provisions relating to the statutory and regulatory authority of the board as originally proposed to extend the board's sunset to 2033. Thank you.
Thank you very much. Vice Chair has a question.
Yeah. Does the bill say three years?
Correct.
Yes.
Megan, you're saying 2 years.
Mhm.
Now you're saying 10 years?
Yes.
Now, where did the 3 years come from?
That was in review when we were pulling together this the package for the departmental legislation in the fall.
So, but who made that review to give you the 3 years?
It was made through, the leadership review of the departmental sunset package.
The leadership from DHM? MDH.
It was, yeah, it was made with leadership of the MDH administration, et cetera.
But then you all don't want the 3, you just want the 2.
Under the current administration, we're recommending
Oh,
2.
it came before the current administration.
Correct.
Okay, thank you.
Thank you. Seeing no additional questions, thank you for your testimony. That will conclude the hearing on Senate Bill 728. We'll now turn to Senate Bill 730, State Board of Social Work Examiners Sunset Extension. We have Daphne McClellan, Megan Peters, and Judith Chagrin. Good afternoon.
Good afternoon. You go first.
Hi again, my name is Megan Peters, again for the record, Acting Director of Governmental Affairs for the Maryland Department of Health. Here today to testify in support of Senate Bill 731 with our amendments. This is a departmental bill for a sunset extension for the Board of Residential Childcare. As introduced, the extension is 3 years, and upon further review, MDH recommends a 2-year extension. We're focused on ensuring that the boards are running smoothly so our healthcare professionals are able to enter and remain in the workforce. And we believe through a more thorough evaluation of our state health occupations boards is needed to address ongoing concerns regarding licensure, technology, administrative functions. We believe a 2-year extension allows ample time for us to work alongside the boards to develop recommendations and come back and provide an update in 2 years. Therefore, we are recommending a favorable report with amendments for this bill. Thank you.
Good afternoon, Madam Chair, members of the committee. I'm Dr. Daphne McClellan. I'm the Executive Director of the Board of Social Work Examiners. I've just had my 6-month anniversary in that position last week. So this is, it's a big job. We have over 17,000 licensed social workers in the state of Maryland. The number of applications is constantly increasing now that we have telehealth, because we have people applying for licensure, from all different states. So it's we are increasingly having more and more people applying for social work licensure. We support this bill with amendment, and the amendment is like my colleagues before me, that we would like to go back to the 10-year sunset extension that has been common in the past. I don't have any, I think you've heard enough about the reasoning for that, and I'm here for any questions you might have.
Hi, everyone. My name is Mary Beth DiMartino. I'm the Executive Director of the Maryland chapter of the National Association of Social Workers, and I would just like to just echo what has been said. We know that there's been some transitions at the Board of Social Work Examiners. They have a new wonderful executive director who's new in her job. It's been a transition. They had a long-term executive director who left. There's been COVID. There's been a lot of things going on. And as you guys know, there is a shortage of social workers. It's one of the most in-demand fields in the state. And there's been a lot of things, happening with COVID and delays and things like that. And we would just like to support this review so that they could have the additional staffing, the additional resources and things needed to process these applications in a timely manner. We just support them and ask that they have the additional resources and things needed to process some really, high demand of things that are happening at the board. So we just support this and ask that you support them as well. Thank you.
Thank you, Senator Lamb.
Thank you, Madam Chair, and thank you to the panel. Ms. Chagrin.
Oh, I'm sorry. I'm
You're not-
Mary Beth.
Oh, you're Mary
I
Beth.
didn't make it. So I'm
Oh,
here.
okay.
I'm the
All right.
executive director at NASW.
So you're Ms. DiMartino.
Yes.
Gotcha.
Thank you.
Okay. So you actually submitted written testimony, this is under your name,
Yes, I did.
for a recommended amendment to, and we've been hearing too from folks that are applying for licensure before the board, where oftentimes their application is in the queue for a long time. And what we had heard is that the board won't necessarily open up the application until very close to the time when they have to begin processing it. And oftentimes there may be pieces of the application that may be missing or not in hand when you're looking through it. And because of that, there's a long delay then in the review process. And I think your suggested amendment here in your written testimony is recommending that there be an amendment for an applicant to be notified within 10 days of the submission, or for it to be reviewed within 10 days as to whether the application is complete or not. So they can notify the licensee that it's not complete, you need to go find other things. You did not touch on this amendment during your verbal testimony. Are you still
Yeah,
supportive of
I
it?
mean, and what I would like to just say is that, you know, we know that there's just been a lot of things going on, that this has been a really tough time for the board. They have been in a transition. COVID's been really hard. There's been, you know, they had the breach of their computers. They had a lot of different things that they've been dealing with. And so, yeah, we are just asking that the additional resources be poured into a system with the things that they might need. I can't speculate exactly what, you know, things they might need, but those would be something that would be really helpful to them. We've heard from our members that, you know, that those kind of things are happening. And, you know, I can't speculate as to what the challenges may be. We know they have some staffing challenges, as all social workers are experiencing right now. And so we would just like to have them have the additional resources and things that they might need. And so we are asking for those kind of things. Yes, would be helpful.
So you're supportive of the amendment, and this is really just a process change for them to open the application sooner so they can let an applicant know that you're missing some information rather than waiting to the end of the period.
Right, right.
Okay. Is the board open to that?
I instituted that change in mid-October. So, yes, we have been down out of 6 people in our licensing unit. We've been down 2. So we only had 4 people, 1 person who was doing the much more complicated clinical license applications. So I found that to be an issue when I first arrived. And so now, as soon as the application comes in, I have 1 individual who's supposed to look through the application, notify the person immediately that we've received it and what's missing. So, and to tell them that until all those things are received, the application won't be reviewed. So that, I think, has made an improvement on getting all the materials there, because it's not helpful when you have a 60-day statutory time limit on approving the application, and the person who's approving it doesn't get to it until day 55 and then finds out that there's something missing. So I wanted to change that so that by the time the person who's approving it gets to it, everything has arrived. So we have put that in place.
So it sounds like, and if I'm putting words in your mouth, let me know that you're open to the amendment because it will align with your current practice.
I don't know if it's an appropriate amendment to the sunset bill, but we are definitely open to putting it, when we have put it into practice already. Yes.
Okay. And my last question has to do with, and you probably heard of this too, that there's a large disparity for the takers of the licensing test, and a large racial disparity where it looks like, I think some of the numbers I looked at in the report, and you're probably familiar with this report too, that like 88 or almost 89% of white applicants pass the social work licensing exam on the first pass, whereas only 54% of Black applicants. Is the board taking any steps to try to get at that disparity? Because I think there's there's probably a legal obligation on the part of the board to try to address these things to make sure that the test is free of cultural bias, right?
Well, I have my testimony for Senate Bill 871 and 872 in my folder because I was working on it this morning, because I'll be back here before you all next Friday when those bills are being heard, which are Senator Washington's bills, which are specifically about the exam. We definitely are working on figuring, by statute, we are required to have a test. And so that's what, and that is the only test that there is the Association of Social Work Boards exam. But we are concerned about the disparities that have been pointed out in their report. We would love to see every healthcare occupation that offers an exam put out the same kind of report so that we would know if social work is different than other occupations. But for right now, I know that we are the only occupation that has that kind of report posted. So we are definitely we are putting together a task force to address what other ways a person might be determined to be competent other than just an exam, or if there's other ways of looking at the exam scores. So if a person has had to take the exam more than one time, maybe additional year of experience or something. So we are looking at a variety of different ways to address the concerns that have been brought up, because we've definitely heard them.
So you have to have a test, but does it have to be this test?
I'll have to look at the statute to see exactly how it is worded in there, but there is no other licensing exam for social workers. Theoretically, we could develop a test, but test development is a huge undertaking.
Okay, if you could keep us posted on the progress of how you're looking at addressing those.
We'll have
disparities,
a
that
lot
would be
more to say about it next week as well.
Okay,
Thank you,
all right,
Senator.
thank you, Dr. McClellan. Thanks.
Thank you very much. I don't see any additional questions for this panel. Thank you very much for your testimony.
Thank you.
That will conclude the hearing on 730. Senate Bill 730. We'll now move to Senate Bill 731. Ms. Peters, I think this is your last one before
I
us
think
today.
so.
We're also going to have Darlene Ham and Crystal Holland Davis. Good afternoon. Okay. You can get
All
started.
right. So like the chair said, one last time, for the record, my name is Megan Peters, Acting Director of Governmental Affairs for the Maryland Department of Health, here today to testify in support of Senate Bill 731 with amendments. As mentioned previously, this is a sunset bill, departmental bill. It was introduced with a 3-year extension. MDH is recommending a 2-year extension with our amendments. We want to ensure the boards are running smoothly and believe a thorough evaluation to assess the ongoing concerns is needed. And we believe this can be done in 2 years, and we'll have ample time to review, bring back recommendations to the General Assembly. So as such, we request a favorable report with amendments for SB 731. Thank you.
Good afternoon, Madam Chair, and members of the committee. Thank you for allowing me to testify before you today. My name is Darlene Ham, and I am the Executive Director for the State Board for the Certification of Residential Child Care Program Professionals. I'm here today in support of Senate Bill 731 with amendments. This bill seeks to continue the State Board for the Certification of Residential Child Care Program Professionals in accordance with the provision of the Maryland Program Evaluation Act, the Sunset Law, by extending the board's existence to July 1, 2034. The passing of this bill will ensure the continuation of the board's mission to protect children living in Maryland residential child programs and to promote quality of care in the field of residential child care. The State Board is the certification authority for residential child care program administrators and residential child care practitioners. The State Board has dealt with challenges times during the COVID-19 pandemic, as well as the MDH cyber network security incident. The board continued to deliver the services for our certified program professionals and potential new applicants with very limited delay of services. The board continued to assist the licensees and applicants during the network incidents, and the board's website was updated regularly to report the progress of the networking system. There are no outstanding licenses or renewals, and we have no complaints. The board complies with all audit requests and works diligently with the auditors to provide documents and anything else required to meet the standards. Therefore, it is crucial for this bill to pass in order to protect children living in Maryland residential programs who are among the most vulnerable individuals in this state. The board supports Senate Bill 731 with amendments to the existing year from July 1, 2027 till July 1, 2034. Amending the term for 10 years will allow the board to achieve success in fulfilling missions and meeting key milestones. Thank you for your consideration, and the board is requesting a favorable report on Senate Bill 731 with amendments. Thank you.
Good afternoon, Madam Chair and members of the Finance Committee. Thank you for allowing me to testify before you today. My name is Crystal Holland Davis, and I am the Vice Chair for the State Board for the Certification of Residential Child Care Program Professionals. I am here today in support of Senate Bill 731, which seeks to continue the State Board for Certification of Residential Child Care Program Professionals in accordance with the provision of the Maryland Program Evaluation Act by extending the board's existence to July 1, 2034. As a member of the board, I am also a certified program administrator working in a residential child care program in the state of Maryland. As a certified program administrator, I witnessed firsthand the complexities and challenges presented by young people and their families when residential care becomes the best and least restrictive environment for healing. There are college degrees for nursing, educators, and social workers. However, there are no degrees for residential child care program professionals. We must have a workforce that is credentialed and well-equipped to serve each individual to the best of our ability. Requiring certifications sets a standard of knowledge, skills, and abilities for all those individuals who commit to this field. This board works tirelessly to ensure that all child care workers and administrators meet the requirements for certification, which ultimately results in professionals with essential knowledge, skills, and abilities necessary to care for the community's most vulnerable children and youth who are unable to live with their biological families due to reasons such as abuse, neglect, severe emotional and behavioral health challenges, and victimization. Amending the board's existence to July 2034 will ensure certified program professionals continue to deliver high-quality services in residential child care program settings. Thank you for your consideration of this legislation, and for these reasons, the board is requesting a favorable report on this bill.
Thank you very much. We have Senator Ellis, then Senator Lamb.
Yeah, thank you, Madam Chair, and thank you, ladies, for your testimony. Quick question. I met with the state superintendent of schools, and mentioned that the state education department work with child care providers as far as the regulation of them. What's that relationship between this board and the State Board of Education as they supervise child care providers?
Do you want me to speak? Yeah. Oh, so this board is residential childcare. So childcare providers provide daycare services or childcare services for families who pay a provider or send their children to quote unquote daycare during the day. Residential childcare program professionals serve in what used to be called group home facilities or residential treatment program facilities, where children do not live with their families, they live and actually reside in those spaces. Okay. So this board certifies the staff of those facilities to be able to care for the children who reside there.
Okay, well, thank you for clearing that up for me.
Sure.
Appreciate it. Thank you.
Thank you. Senator Ellis.
Senator Lamb.
This has been a very long week. Senator Lamb.
Well, I'm flattered, so thank you. I just have one question, and this is because we've been hearing, particularly during the pandemic, more and more folks get out of the childcare industry. And granted, this is a little bit different than I think some of the traditional childcare centers that Senator Ellis was actually talking about. But I think it's relevant here in that it could impact the board and the functioning itself. I assume that you're self-funded as well. Are you seeing a reduction in the number of applicants or renewals? Because I'm looking at your annual report, and I think in FY22, it looks like there were 246 residential childcare practitioners that did not seek renewal, right? So we're non-renewed. Is that trend going down, or is that going up, or what are you seeing there?
Well, I'll speak first and then Darlene, but I believe the reduction has to do with across the state, some residential childcare programs have closed. And so that affects the number of staff that require certification.
And are you seeing an increase of that as a result of the pandemic, or was it tied to the pandemic, or no?
I'm not certain if it's a result of the pandemic or not.
I think it's just overall.
Mhm.
Just
We have
overall.
a lot of programs that are closing. Initially, we had more residential childcare programs, but now we're having programs that are closing. So that's a reduction in the amount of applications that we are getting in versus before we were getting in a large number. But
Okay. All right. Thank you, Madam Chair.
Thank you very much. I don't see any further questions, so thank you very much for your testimony. Have a good afternoon. That will complete the hearing on Senate Bill 731. We will now turn to Senate Bill 827. Senator Hayes. State Commission of Real Estate Appraisers, Appraisal Management Companies, and Home Inspections Sunset Extension. If you have a panel, you can bring them up.
I believe some of them are virtual, Madam Chair. Good evening, good afternoon, Madam Chair. Senator Antonio Hayes from the 40th Legislative District. Madam Chair, last year we had Senate Bill 213 come before the Senate Finance Committee just as an extension. It was at that time, Senator Land, that I learned from our own counsel, David Smolsky, that the Department of Legislative Services no longer evaluated each of the extensions as they came to us, but it was only after expressing the legislature that they would do a review. And so we learned that last year. And so when this bill came, obviously, Madam Chair, we've heard a lot of news reports about appraisal biases and things like that happen in that nature. This board is actually the depository of complaints and also provide licensure to the appraisers that happen in this state. And so we had conversations with DLS, and we felt that and just instead of just extending the board's authority, we wanted to make sure that we had a thorough evaluation, independent evaluation, and make sure that their practices were in line with the national standard. And so this committee and the Senate and the House unanimously passed this bill in its current form last year. We got held up on some procedural moves at the last day of sine die. And so with that, Madam Chair, I ask for a favorable report for Senate Bill 827.
Thank you, Senator. So your sponsor panel are the virtual witnesses, Todd Blackistone and Andrew Foganiti.
Yes.
Okay, good afternoon. You all can proceed.
Good afternoon, Chair Griffith and Vice Chair Klossmeyer and members of the Finance Committee. For the record, I am Andrew Fulginiti with the Maryland Department of Labor. I'm here in favor of Senate Bill 827, which, as the Senator noted, extends the State Commission of Real Estate Appraisers, Appraisal Management Companies, and Home Inspectors. The commission serves a critical role in Maryland's economy, having a direct impact not only on those who offer appraisal, home inspection, and real estate brokering, mortgage lending, and home improvement services, but those who actually require and consume those services. I do want to thank the bill sponsor, Senator Hayes, for working with the department over the last few years. As he noted, this is something we've been working on since last year, addressing some of his concerns in the industries, particularly with home appraisals and reports of bias in that industry, and just a lack of general diversity amongst those who provide the services. Just wanted to note that the department is committed to working with the sponsor, with the Appraisal Foundation and this body to find ways to ensure that consumers are being protected from bad actors in the industry, and that we continue also to explore workforce development opportunities to better ensure that there's an open pathways and eliminate barriers for those who want to offer these types of services but find it difficult to do so. So with that, I'll end my testimony. I'll thank the committee and ask for a favorable report on Senate Bill 827.
Thank you. You can proceed. Todd.
Yes, thank you, Madam Chair. Thank you, Senator Hayes. I'm in support of Senate Bill 827 as well. I'm simply here to be available for any direct questions toward me. For the record, my name is Todd Blackistone. I'm the Executive Director for the State Commission of Real Estate Appraisers, Appraisal Management Companies, and Home Inspectors. Thank you.
Thank you very much. Thank you for your testimony. I don't see any questions for the sponsor or his panel. We have one other witness, signed up on the bill. That is an in-person witness, Gregory Morgan. Okay, don't see Gregory Morgan, so that will conclude the hearing on Senate Bill 827. We'll now turn to Senate Bill 644. We don't have that senator here, so we'll go. Oh, you're presenting?
Yeah.
Oh, thank, because no one told us. Okay.
No, he just texted because he's still chairing the,
Okay, well, I'm gonna need some extra help in the budget. Okay, we're gonna turn to Senate Bill 644. Senator McCray's Maternal Mortality Review Program, local teams, access to information and records. Good afternoon. I'm assuming you are the sponsor panel, so please introduce yourselves before you present. Thanks.
Hello, everyone. Good afternoon to you and members of the committee. My name is Tamika. I'm filling in on behalf of Senator McCray. I'm going to read his testimony to you guys. I write to you urge you to support Senate Bill 644. Senate Bill 644 was created to lessen the fatal mortality rates of infants and create awareness of the issue. In approving this bill, the state health department will work in concert with the local health department. The maternal mortality review team will work to identify the root of which maternal deaths occur. This will allow the team to be able to provide recommendations to legislators and healthcare facilities to prevent these occurrences from happening in the future. Together, the local health department will be able to better assess the deaths of children and infants in the community. In approving this bill, the state will be obligated to provide necessary information to the local jurisdiction immediately. Providing data promptly increases the chances of gathering and analysis for our constituents in need of answers. It is critical to do what is best for our community. Providing methods, recommendations, and knowledge is what we need. For these reasons, I respectfully ask for your support in approving Senate Bill SB 644. Thank you for listening to me today. May I present the panel? I'm sorry. I apologize. We have Mr. Noel Mummy from the mayor's office and Kathy Costa with Baltimore City Department of Health.
Good afternoon, Chair Griffith, Vice Chair Klossmeyer, members of the committee. I want to thank Senator McCray for sponsoring this bill and letting you know that the Baltimore City Administration fully supports Senate Bill 644. And to let you know that we do have the backing of all local health departments for this bill. And I will turn my testimony now over to Kathy Costa from the city's health department.
Thank you, Chair Griffith, Vice Chair Klossmeyer, and members of the committee. My name is Kathy Costa. I am in the Bureau of Maternal and Child Health at the Baltimore City Health Department. And in 2019, the Baltimore City Health Department worked to pass legislation to allow health departments around the state to convene local maternal mortality reviews in order to address the crisis of maternal mortality. And the legislation we passed was a compromise, and it required local teams, rather than independently abstracting medical records to create our cases, it required us to get summary information from the Maryland Department of Health through their state maternal mortality review committee. And what we have found, we launched our team in 2021. What we have found is that we have had, in some cases, difficulty obtaining that summary information. There are, delays of months at a time in getting it. So we've had to cancel or delay meetings. What we've also found is because we haven't abstracted the records ourselves, team members, when we review the case, have questions and we're not able to answer those questions. And if we had the abstractor in the room, we would, because the summary is, necessarily a reduction of what you'd find in the records. If we had the abstractor in the room with their notes, they would be able to answer these questions. So we then respectfully ask for the ability to abstract these records ourselves. There may be some concern that this is duplicative with the state health department, state team, and that we're inundating medical providers with requests for records. I will note that there are usually between 2 and 12 deaths in an entire year in Baltimore City. So this is not a large volume of medical records that we would be seeking. And it has been argued that there is nothing in this statute that actually prevents us from requesting the records. What we really need to have in the statute is not just that we can request, but that providers actually are obligated to provide them when we request. Otherwise, they would not do so for patient privacy concerns.
Thank you very much. Senator Bidle.
Thank you, Madam Chair. Ms. Costa, thank you for being here. I'm not familiar with the prior legislation. Is it simply to review when a maternal death has occurred? Or are you looking at services that person may have received? I mean, this is something has interested me for a long time, and our numbers of maternal mortality we're not improving. It's not.
Right.
And so I had an interesting meeting this year with some doctors at Kaiser who didn't even know that the health department had pilots to do home visits and be able to take home blood pressures and, submit it electronically. So I have a great deal of concern that we've put a lot of programs in place, but we're not, when I say we, the state doesn't seem to be really using the programs as much as they could. And so as you look at these records, what is it you're trying to gain from reviewing the records of the deaths?
That is a really good question. And that is really why we wanted to be able to review records at the local level and not only at the state level. At the state level, when they review, they're primarily looking at the medical records and trying to determine whether the death was pregnancy related or pregnancy associated and whether it was preventable. When we're looking at the local level, we're really, in addition to looking at medical records or summary information up to this point, we also request records from the home visiting program, from WIC, from Department of Social Services, from city schools, all of our partners around the table. We can do a lot more in-depth on services. And so we're looking closely at where were the gaps? Did mother get the referrals that she needed from the healthcare system, but also from other systems? Was she part of home visiting or was she not? And of course, what we find is often these services are really underutilized.
Yes.
So we're using the process, and we've used fetal infant mortality this way for a year, that review process, to really strengthen the local service system.
So is this bill is just for Baltimore City, or is this for all the boards statewide?
This allows the original legislation allows any local health department in the state to start a local maternal mortality review committee. To my knowledge, Baltimore City is the only one that has actually started it.
Okay. I'd like to get some more information and share it with my counties. Thank you very much.
Sure.
Thank you, Senator. I don't see any additional questions. Tamika, will let the senator know you did a good job. Thank you very much. Thank you for your testimony.
You're welcome. You guys have a good day.
Thank you. I see no additional witnesses on the bill, so that concludes the hearing on Senate Bill 4644. We'll now turn to Senate Bill 494, which is Senator Guile, Maryland State Department of Education, Employee Status and Designation. And please bring your panel.
Good afternoon, Madam Chair, Madam Vice Chair, fellow members of the Senate Finance Committee. For the record, Senator Dawn Guile, District 33, here to present SB 494. This bill is simple and narrow. It converts around 150 employees who work at the Maryland State Department of Education and who are currently misclassified as at-will special appointees into merit positions within the state personnel management system and places them within their appropriate bargaining units. To put this bill into context, prior to 2019, the Maryland General Assembly classified a substantial number of state employees as at-will at MSDE. In 2019, the General Assembly changed this practice through the passage of HB 390, which required all hires since July 1st, 2019 at MSDE to be merit hires. As a result, employees hired as special appointees prior to July 1st, 2019 are now working alongside peers who do the same work, have less seniority, and have more rights. This is unjust and needs to be rectified. These misclassified employees are clerical employees, licensing specialists, caseworkers who would have merit rights if they worked in any other state agency, but they were hired at MSDE at a time when all employees were hired in as special appointees. Special appointments have specific criteria in statute, which include a position to which an individual is directly appointed by the governor by an appointment that is not provided for by the Maryland Constitution, a position to which an individual is directly appointed by the Maryland or by the Board of Public Works, as determined by the secretary, a position which performs a significant policy role or provides direct support to a member of the executive service, a position that is assigned to the government house, a position that is assigned to the governor's house, and any other position that is specified by law to be a special appointment. The decision to keep special appointees who do not meet the aforementioned criteria is simply a policy decision. The merit system provides more than just for cause determinations. It also guarantees merit employees reinstatement rights should there be a layoff, a fair process for promotions and training employees, a transparent hiring process, the right to seek damages if there's a paycheck error that goes unresolved, the right to a grievance procedure to resolve disputes, and so on. SB 494 fixes this problem by requiring the Secretary of Budget and Management on or before January 1st, 2024 to assign each employee in the State Department of Education to the executive service, management service, professional service, or skilled in the state personnel management system. Ensure these employees assigned shall suffer no reduction of pay or benefits resulting from this assignment. Ensure employees who are placed on a new salary schedule are at a grade and step that results in a greater annual rate and pay. Per the fiscal note, SB 494 would not have a direct fiscal impact on the state. This bill provides a common sense solution to this misclassification issue and grants the rights and status to these affected employees that they deserve. For these reasons, I respectfully request a favorable report on SB 494. Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. For the record, my name is Cindy Smalls, representing ASME Council 3 state employees plus higher ed. Coming in favorable with SB 494. We thank the senator for introducing this bill for us. I think she did a great job in laying out what this bill is about. We just think that these misclassified employees should have the rights that all state employees have. These are employees that are in the pension system. They are getting health benefits, but they don't have the rights that other coworkers that they have that they're working alongside. Again, if they were in any other state agency, they would be considered merit employees. And so we ask for a favorable report on this, and thank you for your time. Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, and the Finance Committee. My name is Jamesa Fawcett Williams, and I work for Maryland State Department of Education. I am a member of ASME Council 3, and I'm also the president of Local 3644. I thank the committee for the opportunity to speak before you today in favor of SB 494, Maryland Special Appointee Bill. I'd like to thank the senator for sponsoring this bill, which gives employees who are currently misclassified as at-will special appointees moved to the merit position. These employees will finally have the same due process rights and access to grievance processes, as well as union rights and the ability to collective bargaining as the rest of their coworkers. As the senator indicated, these employees are clerical employees, licensed specialists, caseworkers who would have the merit rights if they were to work in any other state agency. We believe that there's nothing in this policy that prevents the department from converting these employees. In closing, I would like to say this bill is about fairness and doing what is the right thing. And I ask the committee, please give a favorable report to SB 494. Thank you.
Thank you very much. I don't see any questions for the bill or the sponsor or the witnesses. So thank you very much for your testimony. There are no additional witnesses on this bill. So that will conclude the hearing on Senate Bill 494. We'll now turn to Senate Bill 574. which is the State Employee Rights and Protections, Personnel Actions and Harassments Complaints, Senator Lewis Young. Good afternoon, and if you have a panel, feel free to bring them forward.
I do have a panel. I believe they're here. Yes, thank you so much. Nice to be back in finance again. Much simpler bill than I had the other day. It's really just a fix to current legislation. Right now, we have authorization for state employment and for a state employee to file a complaint, either going through the hiring process if an individual feels that in some way they've been discriminated against, whether it's they haven't been hired for discriminatory reasons or they were asked inappropriate questions, or while you are an employee, if you feel like you've been harassed. Right now, the timing is if you are current law says 30 days, you have to complain about a hiring issue. And current law is silent on EEOC. And this pertains to all state employees except General Assembly and judicial employers. So what this bill does is change the timeframes. It says you have 1 year to report a complaint for a hiring issue and 2 years for an EEOC issue. As I mentioned, current law is silent on the EEOC issue. Why did we choose these timeframes? Well, the key reason is to be in conjunction with the timing we have for all other employees. Now, I will mention that Virginia and Pennsylvania provide a 1 year timing for both, but we chose the 1 year and 2 year period to be consistent with other state practices. As I'm sure you're well aware, when individuals feel they've been discriminated against or they feel that they've been harassed, it's not something they typically come forward with right away. It takes a while to process it and maybe consult with the appropriate individuals. In fact, the number one reason people don't come forward immediately is they're concerned about retaliation. So they also will wait until they either move to another department or the line of command changes. So we want prospective employees and employees to have sufficient time to do what they have to do to bring these issues forward. And we also want to be compliant with other state practices. So as I said, pretty simple change, and I'd like to pass it on to my panel.
Thank you. Good afternoon. My name is Denise Gilmore. I'm a legislative director with AFSCME Council 3. We represent 30,000 state and higher education employees across Maryland. We very much want to thank Senator Lewis Young for bringing forward this important bill. Honestly, the senator did a wonderful job explaining it. I will just, testify from our end. It is quite common for employees to reach out after the current timeline that's in law around issues around harassment for all the reasons that the senator said. It can be scary to bring these types of complaints forward. And, I think this goes along with other efforts the General Assembly has made in recent years to extend, complaint timelines. In general, we always support those. I think giving employees more time to consider, this sort of complaint really is fair. And so we would urge the committee to please provide a favorable report on SB 574. Thank you so much.
Thank you. Are there any questions for the sponsor or her witness? Okay, seeing none, thank you very much for your testimony. We do have Adrian Muldrow signed up on the bill.
Yep, the union is here.
I'm staying with the union now. Well, I would like to add.
Well, come on up, sir. You've got 2 minutes at the mic. Come on up and have your say. Good afternoon.
Good afternoon. Good afternoon, panel, all the senators. Thank you, guys, for what you do and giving me the opportunity to be heard. Yeah, I just wanted to add for new employees too, for the state and also, is it just for state? Is this bill just associated with state employees too? So I know you guys can't regulate the private sector, but at the end of the day, those kind of issues exist there too. You know, I'm not gonna sit here and legislate. You know, you guys know what you're doing for sure, but I just wanted to ask that question. Is it just for the state or is it also the private sector?
So let me just suggest the sponsor sitting behind you nodding. So you may want to check in with her and she can probably explain to you a little bit more, but.
All right, cool.
Okay.
All right, thank you.
Thank you very much. Thank you for your testimony, and that will conclude the hearing on Senate Bill 574. We'll now turn to Senate Bill 421, which is the State Personnel Teleworking Programs, Policies, and Guidelines Requirements. Senator Heddleman.
Is it okay to bring up panel?
Yeah.
Good afternoon, Madam Chair, Madam Vice Chair, members of the Finance Committee. I am very happy to be here. I am Shelley Heddleman from District 11, and I am here to talk about Senate Bill 421, which really seeks to standardize teleworking policies. We know that many employers were pretty resistant to teleworking before they actually had to during the pandemic. And suddenly we found ways to make it work. And we found ways to make it work across state government even. We passed a bill in 2021 and it required state government and all of our different branches, as well as public institutions of higher education, to have teleworking policies. This bill really just builds on that bill, and it builds on kind of the foundation that it was created during the pandemic as a result of necessity, and it continues it to make it more consistent. It actually doesn't say that you must do this or that employers or bosses must do this, but it creates some consistency in policymaking across government. It does it and it makes it more equitable by doing it in 4 main ways. It looks at eligibility. Who has a job that actually can do the work via telework? It doesn't say if you have a job that doesn't make sense for you to telework that you have to telework. Obviously, certain drivers are not going to be able to telework, certain hands-on direct service workers are not going to be able to telework, but there are many workers who can. And it also gives the employer the ability to look at the individual employee to make sure that they have the capacity to be able to telework and what their record of work has been to do so. Have they passed probation? Has this position had someone who's teleworked before? Do they have the capacity to do it? And then it also kind of puts some standards in there for judging that. Has it been done successfully? Has the worker worked successfully? What are the operational needs of the unit and the other people in the unit who actually are teleworking? The possibility of a hybrid schedule, an in-person schedule, and the flexibility. And then it standards the request, approval, and termination processes. And I'm not going to go through those details. They're in the bill. And then under the University System of Maryland, it creates one policy instead of requiring that every specific university be able to do it. It integrates it into a negotiated telework policy to cover 6,000 workers across the system, which as a parallel, we did this across the executive branch in a non-negotiated way for 20,000 workers. So I think that we can do that. Telework is not for every employee, but telework policies should be for every employer. We are at a place in this committee, and I know certainly my committee, each of us have heard the necessity for finding more state workers to attract to state government. This is actually one way we can do it. And we don't want to leave it to the whims of each individual supervisor. We want to have consistent policies and ensure that folks across state government are being treated fairly and equitably. And we think this bill goes a long way to doing that. So thank you very much. And I ask for your support of Senate Bill 421. And I'd like to turn it over now to my panel.
Sorry. Good afternoon again. This is Denise Gilmore with AFSCME Council 3. We represent state and higher education employees, and we support SB 421, and we're very appreciative of the sponsor for introducing it. Senator is absolutely right. For us, this is an important bill to help us with the recruitment and retention of state employees. I've personally seen the resignation letters from state employees who are leaving because they were able to telework during the pandemic, proved that they could do the work remotely when they were forced to. Then the restrictions were lifted and they came back and, were told that teleworking is now off the table as an option. And they left. They left to go to other jobs that allow them to telework, oftentimes with the federal government. And so we think that this bill is incredibly important to set just some basic guidelines on to prevent unequal treatment, to encourage flexibility in determining telework eligibility, and to ensure that employees have a procedure to apply for telework. We think this bill is very similar to other procedures that we've put into place around, we've allowed for there to be basic guidelines around hiring, around EEO policies, around grievance procedures. In our opinion, placing some basic guidelines on telework policies very much falls in that line. And we think it would be helpful for our, certainly our telework policies within government to really lead the way and have those, guidelines be standardized so that we can ensure that they're consistently applied. That's what we're going for. We're not trying to expand telework to classifications that can't telework. We just want to make sure it's consistent and fair. So with that, we urge a favorable report on SB 421. Thank you.
Thank you. Good afternoon, committee members. My name is Cherish Vick. I am the Secretary Treasurer of AFSCME Maryland, and I'm a 15-year state employee at the Maryland Department of Human Services. I'm in support of SB 421. I'm a family services caseworker too, which is a critical job for the state. My coworkers and I conduct home visits to ensure that vulnerable adults have the services that they need to remain safe in the community. Teleworking has given me the opportunity to complete my paperwork from the comforts of my home without a long commute, which has eliminated a stressor for me and has environmental benefits. I'm still able to provide the same level of quality services to my clients while teleworking. I'm accomplishing the same task as I would in the office. Teleworking allows for a better work-life balance. I'm already home when the workday ends, so there's some time for me to spend outdoors with my child. If I were commuting, that time would be spent sitting in traffic. Prior to the start of the COVID-19 pandemic, teleworking was not an option at all at my agency. We began to telework during that time and the practice continued. However, this is not the case with all state employees. We know that there are other state agencies that have not allowed workers to continue to telework. There are state employees in similar job classifications as myself who are not afforded the privilege of teleworking. This hinders recruitment and retention. We all know the state has a vacancy rate of about 10,000 pens. We cannot afford to lose state employees to other jurisdictions. Teleworking should be used as a recruitment tool as well as a retention tool. So I do urge a favorable report on Senate Bill 421. Thank you.
Thank you. Are there any questions for the sponsor or the panel? Thank you very much for your testimony. We have additional witnesses signed up on the bill. Carolyn Skolnick. signed up in opposition to the bill? Good afternoon. You can come on forward and get started as soon as you're ready.
Thank you.
Thank you.
Thank you, Chair Griffith, Vice Chair Klausmeyer, and members of this committee. I appreciate the opportunity to testify today on Senate Bill 421. My name is Carolyn Skolnick, and I'm the Associate Vice Chancellor for Policy and Human Resources at the University System of Maryland. This bill substantially revises the recently amended current laws governing, one, the collective bargaining negotiations for the University System of Maryland, and two, telework for all state employees. Last year, the law governing collective bargaining at the USM institutions was amended to allow consolidated collective bargaining if the union requested it. This means that the union can shift negotiations from the individual institutions to the USM's chancellor's designee, resulting in one consolidated memorandum of understanding covering all those bargaining units. However, that law specifically exempted telework and certain other issues from this requirement. Those issues must still be negotiated locally with the president of the institution and memorialized in a separate agreement with the institution. That decision reflected an understanding that certain issues are best handled at the institution level and not the system level. The USM is concerned that Senate Bill 421 would dilute an institution president's statutory authority to make key operational determinations to carry out the institution's chief unique mission. Each USM institution has implemented a telework policy and procedures under the authority of the institution's president. Telework is widely available and at all USM institutions, but it's not appropriate for all positions, particularly student-facing positions. A second concern about the bill is that it prohibits the university from denying an employee's application to telework if another eligible employee in the same job position or classification anywhere in the university is found eligible for it. This means that an institution may be required to approve telework requests for countless employees merely because a single employee in the same job class has been deemed telework eligible. So I have further comments, but you have my written testimony. I'm happy to answer any questions. For these reasons, the USM respectfully urges an unfavorable report on this bill.
Thank you very much. I don't see any questions from the committee, so thank you for your testimony. We do have two virtual witnesses signed up on the bill. We'll start with Miriam Osborne Elliott. Good afternoon.
Good afternoon, and thank you for the opportunity to be here today. My name is Miriam Osborne Elliott, and I'm a member of ASME Local 1072. I'm testifying in support of Bill number 421. Currently, I serve as the Assistant Director for Student Development and Academic Outreach at the University of Maryland, College Park. I provide academic support services for the multi-ethnic student population at UMCP. During the pandemic, we had to pivot all of our current operations from being entirely in-person and walk-up based to being entirely virtual. Now, because of the lessons we've learned, we've adopted a hybrid model, and I am able to telework at least 2 days per week. Telework affords me the flexibility of being able to schedule multiple meetings a week across departments that I physically would not be able to manage on a campus our size. I also have an aging mother, and rather than having to take off a day once a week to be physically in the house with her, I can telework and still be with her. This flexibility has allowed me to be more productive and is less stressful to our entire family. I'm asking your support of SB 421 because all USM employees, regardless of which department or campus they work on, deserve to have a fair opportunity at accessing telework, whether we work at UMCP or UMES. We all deserve to be treated equitably, consistently. It is my sincere hope that as you deliberate, you will provide a favorable report on SB 421. Thank you for your time today.
Thank you very much for your time and your testimony. There are no questions from the committee, so we'll move to our next witness. Quiana Tillman. How did I do? Kiana, okay.
You were
Close, I was close.
Very much so.
Good afternoon, you can proceed.
Okay. My name is Kiana Tillman, and I'm a part of ASME Local 1833. I'm the Director of Student Outreach and Leadership Development here at the illustrious University of Maryland Eastern Shore, and I'm testifying in support of Senate Bill 421. To be honest, I love my job, I love my students, and I enjoy both virtual and in-person interaction with them. But if we had to talk numbers, 65% of my job is student-facing and has to be in person, but the other 35% is administrative and requires me to either sit in front of a computer, answer the phone, respond back to emails and text messages. And during the pandemic, I was doing all of this from home. Then once the restrictions were listed, we had the option to telework, but now it's more so those with ADA accommodations could only get the telework policy. I don't think that it's fair that my university chooses to have a blanket no telework policy when my same position at other campuses still has the ability to telework. If we're being truthful, in my position, even when you're off, you're still on the clock, you're still at work. Whether you're answering phones at home, responding back to emails, or giving directives, essentially you're teleworking even when you're not on the clock. I personally have a toddler, and having the option to telework would mean that I have more flexibility to run to aftercare to get him and to come back home without a lot of disruption in my work. Very much so, it would help increase my productivity. This legislation gives me and my coworkers a chance to negotiate a global telework agreement with the USM and make the decision who can telework more fair and more consistent. So with that being said, please provide a favorable outcome for Senate Bill 421. Thank you.
Thank you for your testimony. There are no questions from the committee, so have a good afternoon. And that will complete the hearing on Senate Bill 421. We're now going to turn to Senate Bill 560. Animal testing and research, human relevant research funding, and animal testing and research licensure. This is Chair Gazone's bill, and I assume his panel is coming forward. Good afternoon.
Hello.
Are you with the senator?
I'm sorry.
Are you with the senator?
Yes, sir.
So you should go ahead and read his opening.
Okay. All right. Sorry. I'm sorry. Thank you, Ms. Chair, Ms. Vice Chair, and members of the committee. My name is Lola Odioye, here on behalf of Senator Gazzoni to present Senate Bill 560, Animal Testing and Research, Human Relevant Research Funding, and Animal Testing and Research Licensure. Senate Bill 560 would create the Human Relevant Research Fund to spur the development of human relevant research. This fund is modeled after the Stem Cell Research Fund and would help accelerate the development of this exciting and more humane research. This bill will move Maryland forward by ensuring our investment in biotechnology includes some of the most promising medical research that is happening today. We are already seeing the impact that human relevant technologies have on advancing human health, discovering cutting-edge solutions that animal testing could have never revealed. This bill as drafted also includes a license fee on institutions that engage in animal testing, but the advocates will discuss amendments that will alter and simplify the funding source to help lower the fiscal note. Senate Bill 560 is a revenue-neutral way to move Maryland toward the future we want, one with solutions to the hardest medical questions and one that is less reliant on outdated animal testing. This bill will ensure that Maryland stays a leader as new non-animal testing methods move to the forefront and will make Maryland a more humane state. Thank you, and we ask for a favorable report of Senate Bill 560.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Vicki Katrinik, and I'm the Director of Animal Research and Testing at the Humane Society of the United States. I'm pleased to be here today to provide testimony urging a favorable report of SB 560. Our thanks to Senator Gazzoni for his leadership on this bill. SB 560 establishes a human relevant research fund in the state of Maryland. This will provide necessary additional funding of non-animal research methods and help cement Maryland's place as a leader in biotechnology. NIH reports that more than 90% of human drugs fail during clinical trials after having completed extensive animal studies. These failures are due to unexpected toxicity in human patients or lack of efficacy. We must do better. I want to be clear that SB 560 does not prevent facilities from using animals. However, it will ensure that promising research techniques are developed to not only eliminate animal suffering, but also to address the very real human need for treatments and cures and provide important safety data. It is not just animal advocates that have been pushing for this change. In 2016, Congress passed a revision of the chemical safety law, which included a provision directing EPA to reduce and replace the use of animals in chemical testing. In its New Approach Methods Work Plan, EPA declared that reducing the use of vertebrate animals for toxicity testing is a priority. The Food and Drug Administration has also indicated a desire to create a cross-agency new alternative methods program, and Congress funded this request in the federal omnibus signed into law at the end of last year. There's also strong public support for this initiative. In a poll of Maryland voters conducted last month, 79% of respondents supported the state investing in research and development techniques that don't require animals. SB 560 is a solution-oriented approach, ensuring that non-animal methods receive dedicated funding to support their development. HSUS urges a favorable report. Thank you.
Thank you, Madam Chair, members of the committee. My name is Eric Alley, and I'm here today representing the Humane Society of the United States. I want to thank the chairman who gave us a lot of time when we were developing this bill. I'm talking about Chairman Gazzoni, who gave us a lot of time working on this bill. I wish he could be here to present his dream. And we especially want to thank our good friends at the University of Maryland and Johns Hopkins University. They have worked diligently with us to make a deal on amendments that leaves them comfortable with the bill and leaves the basic principles intact, that we will do this important research and that those who currently use animals in testing will help finance it. I wanted to briefly review the amendments that Humane Society Hopkins and Maryland have agreed to. We don't have them in hand yet, but we understand you're going to have them any minute. But the concepts are pretty clear. And they are, we're going to switch to the definition of covered animal and the Federal Animal Welfare Act, which narrows the species of animals in the original version. We're going to get rid of the licensing and fee structure, which should dramatically reduce the fiscal note. We don't necessarily agree with the fiscal note, but we're working on reducing it anyway. And the licensing and fee structure will be replaced by a mandatory contribution for each entity based on how many covered animals held that year. Each USDA registered research facility is required by the Animal Welfare Act to submit an annual report that documents its use of animals in research and testing. The entities will make their annual payments based on the number of animals reported on this form. So again, we've dramatically streamlined the process, and there won't be a whole licensing and fee structure that you see in the original bill. Also, the criminal penalties will be removed. And also, we thought that with its similarity to the stem cell program, that this would be great to be housed in TEDCO and it would run similar to the stem cell program. But if in its wisdom, the committee thinks it should be somewhere else, we're of course happy with that. We just want to get the program up and going. Thank you very much.
Thank you very much. We have two additional members of the sponsor panel that have joined us virtually. We'll start with Keith Murphy and then go to Jim Colbert. Good afternoon.
Thank you. Thank you, Chair Griffith and Vice Chair Klausmeier, for the opportunity to submit testimony on SB 560. My name is Keith Murphy and I'm CEO of a San Diego biotech that works in this area. I think this is critical legislation that would advance the use of non-animal testing methods in medical and product research and mark Maryland's commitment to developing safer and more successful drug therapies. I and those in my field appreciate your efforts, and I wanted to provide the perspective of an entrepreneur and innovator working on new non-animal testing methods. I'm here to tell you that we are on the cusp of a major technological revolution. The technology exists today, and we can do a lot to continue to develop it, to dramatically improve our ability to develop drugs, improve the likelihood of success of drugs in clinical trials, and lower the costs of drug development. For patients, this can mean more new breakthrough therapies and lower priced drugs. But first, this technology needs financing and grants to be taken up more broadly and developed. Several companies now are in the early stages of applying more modern technologies, such as 3D bioprinted tissues made from human cells from a patient, to avoid the species gap that gives the wrong answer in clinical trials and over-reliance on rodent and animal models in pharmaceutical research. Our company, Vizient Biosciences in San Diego, which has a superior model for liver fibrosis made from human cells, is leading the way along with others. Several major big pharma drug programs in this space have failed to reduce liver fibrosis in patients with their drugs in the clinic. 2 have been successful. Animal models predicted all of those drugs would work, including the ones that failed, but our 3D human model shows exactly which 2 reduce fibrosis successfully and which ones failed to do so, i.e. we predicted it and could have saved the companies hundreds of millions of dollars on the failed clinical trials. These models and other technology to do better than animal models exist today, but need more support to be more broadly used. Your efforts through this legislation will yield great benefit in making them used sooner with greater impact. The result will not only be beneficial in the sense of less use of animal models, but will end the ethical problem that is using humans in experiments doomed to fail. Thank you very much for your time.
Thank you. You can proceed, sir.
Thank you, Madam Chair and members of the Maryland Senate. My name is Jim Corbett. I'm the CEO of Emulate, a leading organ-on-chip technology developer. I offer my support Senate Bill 560. There's no doubt that animal models have contributed to major scientific advancements and to safe and effective drugs making it to market. However, these models have the difficult job of approximating the human body, and sometimes they get it wrong. Of the last 12 months alone, there are 6 high-profile examples, well-known examples of companies that saw drug-induced liver injury present a problem either in terms of stopping clinical trials or in one case causing fatalities after passing through animal testing requirements. 21st century science is proving that there's a more safe and more humane path forward. In a recent study published in Communications Medicine, part of Nature Portfolio, researchers found that Emulate human liver chip to have an 87% sensitivity and 100% specificity when differentiating hepatotoxic from non-hepatotoxic small molecules. Importantly, all 22 of hepatotoxic drugs included in the study had previously been classified as safe due to a lack of toxicity in animal models. Collectively, these 22 compounds resulted in 208 patient fatalities and 10 liver transplants. Had the human liver chip been used during the preclinical screening of these compounds, it's likely that many of these fatalities could have been avoided. Moreover, researchers also found that by improving our ability to detect hepatotoxicity with 87% sensitivity, it's estimated the human liver chip could increase research and development productivity by $3 billion for the pharmaceutical industry on an annual basis. However, transitioning to human relevant research testing method requires funding programs in order to continue to spur scientific innovation. Funding programs for human relevant research will lead to new education and career opportunities, as well as a positive impact on the economy of Maryland. For these reasons and more, we urge you to pass Senate Bill 560.
Thank you very much for your testimony. Senator Lamb has a question for the sponsor panel.
Thank you, Madam Chair, and thank you to the panel. Mr. Galley, I think you cited the fact that TEDCO has a different fund, I guess, that they or grant that they administer similar to the lines of this. This is kind of in line with what they do.
Yeah, well, they managed the stem cell research program, and we actually modeled this bill. You might say we stole the language from the stem cell research law. We thought this is a much smaller version and that it would be good to run right alongside it.
Okay. So this is, that fund is much larger, I guess you were saying.
Yeah, that fund averages about $21 million a year, and it gets the money from the general fund.
And you expect about 3 million in this one?
That's what we're hoping for.
Okay. Because I was looking at the fiscal note, and granted the fiscal note may change based on these amendments that would be coming forward. The fiscal note seems a little high for just a $3 million fund. They were asking for a whole bunch of people just to administer a $3 million fund. So I think the scale there is important to kind of note between that and the stem cell, I think, fund that you had said. You also said that I think we're pending the amendments that are coming forward. You said this would align up with federal reporting that needs to go forward. And allow the institutions that have this research going on to be able to basically self-submit a mandatory contribution after that reporting takes place. So that timing should all line up then.
Yeah, exactly. They would submit that report on or before December 1st, and then on January 15th, they would just make the payment based on that report. It's an existing federal report that they have to do, which again is much simpler than the original version in the bill.
It sounds like 75,000 is the maximum. Is this a sliding scale based on amount of research that they're doing, or?
It is, and that too is in the bill.
Okay, we're in the amendment.
Yeah, in the amendments, I'm sorry.
Right,
Yeah.
because the bill doesn't have that piece. The bill's.
No, we changed it in the amendments.
And do you know how many institutions you're expecting would be contributing to the fund?
I think there's approximately around 20 that use covered species.
Okay, all right. Okay, thank you, Madam Chair.
Thank you, Senator. I don't see any additional questions for the sponsor panel. Thank you all very much for your testimony. We do have several additional witnesses signed up on the bill. So we'll call forward Jennifer Bevan Dangle, Lisa Radov, Aisha Akhtar, Kimberly Fullerton. Good afternoon.
Good afternoon. And I don't believe Aisha was able to be with us today, so we apologize. My name is Jennifer Bevan Dangle, and I'm the State Director for the Humane Society of the United States here in Maryland. Thank you for the opportunity to speak to this important legislation. We understand it's a Friday, so I will try to keep my remarks brief. But we do want to stress, Maryland already makes a significant investment in our biotech. It is an industry that we are proud of, that we have every reason to be proud of, and that we have really taken concerted efforts to foster and to grow in this state. We see this legislation as a critical component to ensure that that investment is truly launching us into the future, that we're focusing on industries and research that is going to last past the 20th century and into the 21st century type technologies. We also are very confident that this type of investment, as we've seen with other similar funds, will help accelerate these emerging technologies, which is good not only for the industry and for Maryland's reputation as a biotech hub, but and also obviously for the animals, but it's also critically important for patients themselves. My sister, very sadly, in the last few years, diagnosed and then succumbed to ALS. That is just one of countless diseases that we still do not have cures for. In fact, when she was going through the diagnosis process, we don't even have a test that could have told her before she passed away that that was definitively what she was suffering from. The emerging technologies that we are starting to investigate and that this bill would help accelerate can hopefully provide cures to these diseases that testing on animals have simply not yet yielded any positive solutions for. So we do believe that this is a patient-friendly and an animal-friendly bill, and we urge a favorable report.
Good afternoon, Chair Griffith, Vice Chair Klossmeyer, members of the committee. My name is Lisa Radov. I'm the Chair and President of Maryland Votes for Animals. Happy to be with you here today in support of SB 560. It is a Friday, and so I will not belabor you. I am not a scientist, nor am I a physician, but just to say to you that this is a very popular bill across the spectrum with our members from a myriad of different professions. And we really appreciate the fact that this would be bringing together business, biotech, and putting everyone together to get cures for diseases in the best way possible. It would also provide jobs for Marylanders, as we already do have made an investment in the biotech and biomedical fields with our many eminent research institutions. Some of you work for them here. So once again, wanted to thank you all for listening, wanted to say thank you and best wishes for a speedy recovery to our sponsor, Senator Gazzoni, and hope for a favorable report on SB 560 for all the patients out there and for the animals.
Good afternoon. My name is Kim Fullerton, and I am Vice Chair of the American Bar Association's Animal Law Committee. I am here today to represent the Maryland State Bar Association's Animal Law section. I have been briefed on the amendments, and I do find them to be appropriate. With these amendments, the bill will be very narrowly tailored. It will serve solely as a funding mechanism for research and testing. It does not require new reporting or additional oversight. The penalty provision will be stricken. The regulatory component is a completely separate bill. So I want to be clear that nothing in this bill limits or prohibits animal testing. You are not being asked to consider those issues today or for the successful passage of this bill. The one issue that is presented to this committee is this: should Maryland promote state-funded research to develop human-relevant testing methods? Absolutely, we should. This bill would accelerate life-saving solutions. It would benefit so many people and medical issues. Maryland is also home to some of the best research institutions in the country. This would directly benefit them as well. And this bill is how we will accomplish those goals. The funding mechanism aims to be revenue neutral. It will not depend on government funds. The framework is modeled after another successful research fund, which has already been administered by TEDCO. So we have a very high confidence that this bill will be an effective strategy for driving critical research. To sum up, Maryland holds itself as a leader in biotech and technology. This bill is an effective way of preserving that interest while incentivizing research that benefits our state, our people, and our animals. I urge a favorable report. Thank you.
Thank you very much. I don't see any questions for this panel. Thank you very much for your testimony. Have a good weekend. We're going to call up the next panel, which is Troy LeMay Stovall, Brendan Canning, Eric Hutchinson, Joseph Mankowski. Good afternoon. You get started as soon as you're ready.
Good afternoon. Madam Chair, Brendan Canning was not able to make it today. Madam Chair, Madam Vice Chair, members of the committee, my name is Eric Hutchinson. I'm a veterinarian. I'm the attending veterinarian for Johns Hopkins University and the Director of Research Animal Research Resources there. I'm also an assistant professor of molecular and comparative pathobiology in the School of Medicine. Thank you for the opportunity to testify today. Johns Hopkins University and School of Medicine support SB 560 with amendments. My work focuses on the treatment and environmental enrichment of animals used in research across Johns Hopkins. My care for them includes basic health care, and that includes reducing pain, but it's also a lot more than that. It's also about creating quality environments for the animals, maintaining their normal well-being, their normal behavior, and caring for their mental health. As a veterinarian and a recognized expert in animal behavior management, I take very seriously the need to ensure that the animals under my care have the maximum well-being they can. Simply put, my job is to care for the animals and to make sure that they're happy and healthy. As a research scientist, I take very seriously the idea that research involving animals remains a critical tool in the toolbox of biomedical research. Medical advances, therapies, and countless treatments still require the use of animals in order to discover. These aims are not in conflict. We at Johns Hopkins are one of the biggest users of alternatives in the state. In fact, most animal experiments start with an alternative. You don't just take a drug and stick it into an animal. You're trying it in a cell culture first. You're using computer modeling. You're doing something else first before you get the go ahead to try an animal experiment. Alternatives are a necessary part of biomedical research and a necessary step before animal research. In fact, Johns Hopkins is already a big booster of alternatives. We are the home to the Center for Alternatives to Animal Testing. For these reasons, I respectfully urge the committee to issue a favorable report on SB 560 with amendments. Thank you.
Madam Chair, Madam Vice Chair, members of the committee, my name is Joseph Mankowski. I'm a veterinarian and scientist, as well as chair of the Department of Molecular and Comparative Pathobiology in the School of Medicine at Johns Hopkins. I serve as the Associate Vice Provost for Animal Research at Hopkins. I urge a favorable report with amendments on SB 560. Almost every medical advance, COVID-19 vaccines, insulin therapy for diabetes, cancer treatments, and organ transplants, is the direct result of research performed in animals. Simply put, modern medicine as we understand it, would not exist or advance without research performed in animals. A prime example is the rapid development of COVID-19 vaccines in a time of great need across the world. Testing vaccines in animal models was essential to provide the world with effective prevention that limited the spread of the virus and reduced COVID disease severity. Much vaccine work was performed in Maryland at Johns Hopkins and the University of Maryland and by partners in the private sector. Ongoing work targets next generation vaccines to improve our ability to prevent COVID-19 spread using extremely well-defined animal models which we call precision animal models that align with the 3R principles. For example, we can rapidly now evaluate new prospective COVID vaccines and novel therapeutics using a test group of only 4 infected hamsters. As mandated by federal guidelines, all of our research and teaching proposals that require use of animals are reviewed by the ACUC committee. They're tracked by the ACUC committee, and no work can start until all aspects of the planned procedures have been approved. Investigators at Hopkins proposing research involving animals must formally demonstrate that they've considered the 3 Rs in their study designs. Our research facilities are subject to intense oversight by multiple federal agencies. And with that background, I urge a favorable report with amendments on SB 560.
Thank you for your testimony. Senator Kramer.
Thank you, Madam Chair. Mr. Hutchinson, I understand from what you said that you are the attending veterinarian, is that correct?
Yes.
At Hopkins. I am really pleased to hear that Hopkins is supporting this very important and timely piece of legislation. My question for you, sir, is what federal agencies have oversight with regard to the research and experimentations that go on at Hopkins?
At Johns Hopkins, we're overseen by the USDA as well as the NIH OLA office.
NIH OLA?
OLAW, Office of Laboratory Animal Welfare, as well as the Department of Defense ACURO. I'm going to admit that I probably can't come up with what that means, but it's ACURO, ACURO.
And which of these agencies actually conduct physical inspections and lay eyes on the animals being used in research and on your facilities?
So the answer is actually all 3. The USDA is the only one that is mandated to visit at least once a year. They visit at least every 9 months, in fact.
And do any of these agencies ever issue some kind of a citation or a notice of some kind that there's a problem that they observe?
Yes, most typically the USDA has issued Johns Hopkins citations. The majority of those have been actually self-reports. So it's a report that we've made to OLA or in our minutes of our Animal Care and Use Committee that then is given to the USDA, and that leads to a citation.
Can you share with me how many of those violations, self-reported and otherwise, occurred in the year 2022?
Would it be possible for me to get you, I can get you that information. Could I get you that outside of this hearing?
That would be perfect. Could I ask that perhaps by the middle of next week, if you would, provide whatever citations have been issued by any of these agencies and a summary of what those were in the years 2022, 2021, and 2020. Provide that to the committee. I would be most appreciative. Thank you. Thank you for that. Thank you, sir. Thank you again for this support of this good bill. Thank you, ma'am.
Thank you. Senator Lamb.
Thank you, Madam Chair. Just one question, I guess, on the research aspect of this. I assume that since you're favorable with amendment, that this does not hinder your research or perspective or ongoing research that you have?
That's correct. With the amendments,
as amended.
we believe as amended, we're in full support of this bill.
Okay. All right. Thank you.
Thank you. I don't see any additional questions for you this afternoon, so thank you very much for your testimony. We have signed up in opposition to the bill, Laura Bogley. Okay, don't see her, so we'll go to our virtual witnesses, starting with Alex Armento. Good afternoon.
Thank you, Madam Chair. Good afternoon to the honorable members of this committee. My name is Alex Armento, and I'm the president and CEO of MatTech Life Sciences, a Massachusetts-based biotechnology company and a leading provider of human-relevant alternatives to animals for product safety and efficacy testing, along with infection studies. MatTech has been in business for over 35 years, and over that time, we have shipped millions of lab-grown miniaturized human tissues to our customers in the pharmaceutical, personal care, and cosmetic industries. We have countless examples of how these human-relevant tissue models are more predictive of human toxicities and human biological responses than laboratory animals. Since I only have 2 minutes with you today, you'll need to take that as my testimony, but I'd be happy to meet with you offline to discuss this in further detail. I'm in support of Senate Bill 560, not because the funding mechanism of this bill would benefit my company. I'm in support of this bill because, as written, would expand and accelerate the development of human alternatives in Maryland, one of the largest biotech hubs in our country. The talent pool in Maryland is vast, and the work that can be achieved, driven by this bill, would accelerate the transformation of an industry that I'm extremely passionate about. Driving down the cost of medicines and accelerating the process for getting new medicines to people in need in the state of Maryland and beyond is what this bill can do. As written, this bill also provides a mild disincentive for companies who choose to test on animals. A wise person once told me that big pharma is like a freighter ship. Once in motion with full momentum, they have the ability to move mountains great distances, as they did with the COVID vaccine, but they're not well built to alter course. The pharmaceutical industry has nearly a century's worth of infrastructure, data sets, and mindsets built on animal testing. Even though human relevant alternatives can provide better data faster and more cost effectively, I believe the industry needs a little help changing course, and I view this bill as a starting point for that. On behalf of our team at MatTech, I strongly express my support for Senate Bill 560. Thank you for your time.
Thank you very much. There are no questions, so thank you for your testimony this afternoon. Have a great weekend. We'll now turn to Pamela Lanford. Good afternoon. Can you unmute, please?
Sorry, my thanks
That's
to the
okay.
chair.
We all do it. We all do it.
The vice chair and members of the committee. My name is Pam Lanford. I am the Director of Animal Research Compliance at the University of Maryland at College Park. As amended, we support the overall concept of establishing the Human Relevant Research Fund to provide additional resources for the development of alternatives to using non-human animals in medical and product testing and research. While animal-based research is necessary for the development of life-saving and life-altering treatments for both people and animals, both UMCP and our colleagues at UMB hold firm to the belief that we have an ethical and moral responsibility to provide quality, compassionate, humane treatment for all of our animals. All of our laboratory animal work must be approved by our Institutional Animal Care and Use Committee in accordance with the Animal Welfare Act, the Guide for the Care and Use of Laboratory Animals, and many other federal regulations. Researchers consider alternatives to use of animals by employing appropriate protocol-specific search strategies. They are guided by the 3 R's: replacement, refinement, and reduction when designing research studies. In justifying the use of an animal model, the principal investigator must submit to the IACUC whether alternatives exist and why they're not feasible for these particular studies. We adhere to all federal regulations, are inspected annually, have internal protocol measures and oversight in place, and provide annual reports to the USDA and other agencies as a registered research facility. It is important to note that animal-based research has resulted in groundbreaking discoveries that have helped save or improve the lives of countless individuals in the United States and throughout the world. UMB has carried out major life-saving medical research using animal models in the development of aromatase inhibitors for the treatment of breast cancer. At UMCP, researchers have developed an inhalable coronavirus vaccine, making it safe for children and immunocompromised individuals. Animal-based research has resulted in treatments for many medical conditions, and we see the benefit of this research in our everyday lives and the lives of animals. Thank you very much for your time.
Thank you very much for your testimony. Senator Kramer has a question.
Thank you again, Madam Chair. And Ms. Lanford, I'm very pleased to see that the University of Maryland system is supporting again this important legislation. Would you please be good enough to put together a list for this committee of any and all violations, citations, whatever the appropriate reference should be, that were issued at any of the campuses of the university system that use animals in research during the years 2020, 21, and 2022, and perhaps try to provide that to the committee at the start of the week, no later by midweek next week. I'd be very appreciative.
I'm happy to assist it however I can. I don't have access to any of the reporting information for anything but the University of Maryland at College Park. And I can tell you that we have had no citations during that period.
Any what? I'm sorry, ma'am.
We have not had any citations during the period that you named.
You have no citations at all?
Correct.
At which facility?
At the University of Maryland at College Park.
At College Park?
Yes.
Okay, during any of the last 3 years?
Correct.
Okay, and can you send us perhaps a list of the occasions in which you were inspected, the dates in the last 3 years? And then you said you do not have access to any other university system information. You don't know the people to whom you might speak with to get that information?
I could certainly reach out. I do have colleagues at other system schools, and I could facilitate that information gathering. They have their individual institutional animal care and use committees that handle these items at their individual institutions. So I wouldn't normally have access to that information, but I'm happy to do that if you would like.
Do you know which campuses use animals in research?
I am aware that UMB does. I believe UMBC does. And of the others, I'm not totally certain. It's not something that I would ordinarily be involved in because they have a separate institutional committee of their own.
Is it possible that you could contact a superior at the university system who might have some responsibility for oversight across the system and ask them to provide that information to this committee at the other campuses if you don't think it's within your capacity to get that information?
I can certainly reach out to the Chancellor's Office for assistance.
Would very much appreciate that. Thank you, ma'am. Thank you, Madam Chair.
Thank you, Senator. I don't see any additional questions for you this afternoon, so thank you very much for your testimony and I wish you a great weekend. Colleagues, that will conclude the hearing on Senate Bill 560. We'll now turn to Senate Bill 668. Senator Rosapep, Mr. Vice Chair, is here on teacher degree apprenticeships.
Yeah,
What?
there's a theme here. There are a couple of reasons for this bill. One is we have a significant teacher shortage, and we know in rolling out the blueprint, we're going to need more teachers, better teachers, and we're also going to need more tutors. As some of you may recall from the blueprint plan, a big part of it is getting kids to be able to read well by the end of third grade. And part of the blueprint is very high intensity, large scale tutoring. So part of the reason for this bill is to help meet that need. But the other reason is that the other part of the blueprint that talks about 45% of high school graduates completing the high school level of apprenticeship is going to be a big lift. And so it occurred to some of us that put the two things together, you have a vehicle to both solve the school's problems in their own workforce needs, and also to basically provide a vehicle for their high school students to fulfill the requirements of the blueprint in terms of being in high school level apprenticeships. In addition, in the budget last year, we asked the University System of Maryland, the community colleges to work with the Labor Department on exploring degree apprenticeships in teaching and in nursing. Sometimes we think of apprenticeships as being for folks who aren't getting college degrees. Not true. In other countries and in this country, there are degree apprenticeships, which is what this would be. It's structured like an apprenticeship, but you're earning a degree while you're earning the credential in the apprenticeship, and you're getting the on-the-job training and the classroom training. So how does this work, and how does this bill work? It says there basically would be 3 levels of the teacher apprenticeship, starting with tutors, who would be the high school kids who would be trained and paid to tutor the elementary school kids. At the same time, in high school, they would be taking the courses we have in CTE now and beginning to go into the teaching profession. They would also, hopefully, not in all cases, but those who could, would be taking dual enrollment early college courses. So conceivably, some of these kids could graduate from high school, have 2 years of part-time tutoring experience, have 60 credits towards their education degree, and then be hired full-time or part-time, depending on how the employers wanted to do it, as teachers' aides. And so they would work as teachers' aides, which we need lots of as well, in the schools while they're completing their BA. So by the time they get to, let's say they're 22, 23, 24, around the age of when folks would graduate from a 4-year traditional education training program, they would have gotten their degree and they would have had 5 or 6 years of classroom experience. They would have learned on the job and in the classroom. So they would be much better prepared to be successful teachers at about the same entry age as our traditional system does it. It also would make it much more feasible for people from lower income working class backgrounds to go into teaching, because the way we do it now with college, as we all know, is basically 4-year degree. You take off 4 years, you go live somewhere, you have all the costs related to college, and it's hard to work. And so economically, it puts a real barrier in front of a lot of people getting into teaching. So what this bill does specifically then is it says we would like to get a group of the unions representing teachers and school employees and school systems to put together a joint apprenticeship program. Now, we often think of apprenticeships as being put together by an employer. In reality, the overwhelming number of apprenticeships in the United States today are joint employer programs. It's employers together. Think of that in the building trades. It's the contractors working together, not just to help that one employer, but grow the pool of people who are electricians or welders or carpenters. And it really works well. We've seen it work well. This takes that idea to teachers. We have multiple employers, multiple school systems that need to hire teachers. We have several unions that represent employees. So what this bill says is if some group of them will put together a joint apprenticeship and training council, as I described is traditional in our other apprenticeships here, that we would give them some startup money. And so all it says is we'll give you $500,000 from the Department of Labor for a group that puts together a joint apprenticeship program for training teachers. Has to include employers, school systems, has to include unions. That's the bill. Thank you, Madam Chair.
Thank you. Are there any questions for the sponsor? I do have a couple of questions, but we can talk offline. It's been a long week. Senator Mouse.
Can you repeat that? Half of what and half of what? Half comprises of school systems.
Oh, I'm sorry. It would be joint. I shouldn't have said half and half. I should have said joint. It would be group of school systems, group of unions representing school system employees.
Gotcha.
Union and management together.
Right.
Which is the way it works in the union apprenticeship programs in the building trades.
Okay.
It just takes that same model but applies it to degree apprenticeships with teachers.
Okay.
Thank you. I'm sorry I was not clear.
Okay, I don't see any additional questions
Thank you.
for you. So that will conclude the hearing on Senate Bill 668. Thank you very much and have a great weekend. Colleagues, that's our last bill hearing for the day. We're going to take our micro break and then we'll come back and do some voting.